welcome back to Top 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Daniel Ronel. We are having a great discussion with Dr. Rita Dodge, who is a local family practice doctor in Santa Fe. We just talked about the socioeconomic implications of organic, local, and sustainable foods. And now I want to talk more about the medical aspects. Rita?
Yes.
Dr. Dodge.
Dr. Dodge, tell me about what you see when you speak with your patients. What is it that you use to convince them to go towards healthier foods?
Well, a lot of the time when I'm doing that, it's because we see an abnormal value on something. So that often helps if someone's triglycerides, the fats in their blood are a little elevated, or their sugar is starting to creep up, or their weight is higher than it should be. Then it makes it a little easier to say, well, you know what, where that comes from is from what we're putting in our bodies and whether or not we're moving our bodies.
You are what you eat, right?
You absolutely are what you eat. And in this country, we've changed our diet so dramatically in the last 50 to 100 years that it has created a problem with our medical state that the processed foods are leading to higher rates of sugar in our bodies, which leads to higher rates of diabetes.
And obesity. There's an obesity epidemic among teenagers in the United States. And there's a big debate actually in the plastic surgery literature about whether we should be doing gastric bypasses on teenagers, because that's a procedure that is getting to be better and less risky, but it's still a very major procedure. And the question is, can you really make a teenager lose their weight with diet and exercise and counseling, or whether you should just go for the big deal surgery? There's a debate.
Yeah, and very difficult too, because I know that if the person's not ready to change a lifestyle, a lifetime of habits, then to just mechanically change things inside of them doesn't always fix the problem either. But I mean, I must say, I certainly have had patients who've had gastric bypass surgery, not teenagers, but adults, who were diabetic and ceased to be diabetic afterwards.
Yeah, everyone I see in my office who's had the surgery is no longer diabetic.
Right.
That's fantastic.
Right.
But that's not the answer. I mean, that's not the answer. It's not an
Right.
easy surgery. It's sometimes expensive, and it can have many other implications. So,
Yeah.
Trying to change our eating habits and our concept about that is where you come in, because it's so important. What are some of the steps that you take, because you can't do it overnight?
Yeah, I'll usually talk to people about making some simple changes in their diet that can have a profound effect. The first one would be stopping soda pop, or at least really cutting back on sodas and those kind of drinks, because I tell people to think about soda in terms of liquid candy, because that really is what it is, and people are so used to having a sweet drink with their food that they don't really even realize anymore that it's not the same as having water with your meal. An average soda, like a Coke, usually has about 150 calories in it. It's got quite a lot of sugar in it. And so you really have to think that you've just had a candy bar with your meal. And it puts it in perspective, and it helps people see, because just cutting out sodas with my patients oftentimes will make them drop several pounds and will bring their sugar levels down. It's really something that should be a treat once in a while, once a month, once, twice a month, not all the time.
What about diet soda?
Right, I was going to say, what about the women who think, oh, I'm doing something good, I'm drinking Diet Coke or Diet Pepsi?
Well, yeah, and so certainly when you do diet, you take away the calorie question. Yeah. So instead of having 150-ish calories, you have like half a calorie. Right. So you do take away the calorie question. You do take away the regular sugar question as well, because they usually have the artificial sweeteners in it. But don't get me started on that, you know.
I'm very worried about those.
Yeah, I mean, artificial is artificial, and it's something that somebody's created in the recent past that our body hasn't been designed over the last million years to handle. So while you are better off having a diet soda than having a regular soda, you're better off having water.
Yes, absolutely.
Well, here's one question. What about the teenage girls that, always look up to movie stars and stuff like that? I mean, I know some people that are famous, I don't know them personally, some people who are famous and known for their awesome bodies as well as healthy eating habits are Cindy Crawford, Jennifer Aniston, Brad Pitt for the men, what's-her-name, Anne Hathaway, who's very hot right now. These are, girls, women that, and men that the average teenager may or may not look up to. Do you ever, if one of them ever says, I want to look like Cindy Crawford, do you ever use that as a ploy? Probably not, but I just have to ask that.
Well, yeah, I don't necessarily.
Don't you want to look like Brad Pitt? Stop the soda.
Grow a scraggly beard. No.
Right, yeah. I mean, it's one of those things where, if actually people really, I knew more about them. I mean, Cindy Crawford, I used to do videos of hers from a long time back. I mean, she really is a very avid healthcare kind of healthcare person. And so the reality is people who are movie stars have a lot of money, can spend a lot of time working out very hard, and they can balance the, maybe some junk with some really intense workouts.
Right.
And the average person, like you and I, we just have to eat healthy all the time and move our bodies all the time so that we can actually see the effects of that. I mean, definitely they're not drinking soda after soda and eating crappy food all the time. You just don't look beautiful if you eat that way. You guys certainly know that your skin is affected by how healthy you eat, the amount of water that you drink. I mean, how much of our skin is water? A great deal of it. And so you definitely are going to get more of that movie star glow if you are putting the kinds of things in your body that nourish it and that don't destroy it, because that's what's the problem.
I find that a lot of my abdominoplasty patients and liposuction patients use the surgery as a starting point, as a kickoff for eating more healthily. And on the other hand, when some come in and say, I'm still fat, I'm still big, I had the surgery, it's really because they still have the fat inside them. Right, because of the processed foods that they're eating and the high calorie, high caloric index foods. We've talked about those before.
Yeah, and I mean, again, the problem is that it comes from a lifetime and, traditional cultural things. So when somebody comes to you in their adult years after gaining all of that weight, that came from day to day, year after year, growing up as children in a home where they ate a certain way and they moved their bodies a certain way, and it just doesn't change overnight. Even when you have a surgery, which is able to fortunately make some changes physically in your body that's quick, it doesn't change the habits and the things that you've been doing for a long time. So when I'm talking to my patients in my office, I'm really trying to educate them about the little things they can do. We talked about soda. I make some suggestions about the difference between processed foods and whole foods, going away from white bread, white rice, white potatoes. I mean, potatoes are white, but meaning French fries and things like that. And going to whole grain foods and a lot less processed foods.
Right.
Excellent.
What about salt intake?
So that's kind of a separate thing in terms of it. It's definitely not good to have too much salt. Leads to high blood pressure. Leads to water retention, which is going to make you feel fatter as well. So it's a separate issue. Except for that, it's part of that processed food problem. So when you process food, you add a lot of stuff to it, like sugar and salt.
Okay, we actually have to wrap it up. Yeah,
but here's what I'm leaving us off with this. The next time Dr. Dodge is on, I want to ask her about all these, they're called terrific diet plans, like Jenny Craig and, Weight Watchers and all that. And I have no issue with them personally, but that is full of processed food. And although the calorie count might be low, the sodium content is outrageous. So I want to get her opinions on that, but women still do lose weight for a while they're on them, so that'll be a good discussion. All right, back to you, Big Dr. Ronel.
Thanks very much for listening. This is the Humanity Behind the Vanity, Talk 1260 KTRC. May 19th, we have an event at Be Beautiful Salon. Get 25% off Botox. The money goes to ending blindness in Africa.